Dr. David Ellison, Chief Scientific Officer and Medical Director for Regen Medical Centers in Westchester, Ohio. I'm here with
Dr. Hal Blatman, the Medical Director for Blatman Health and Wellness Center here in Blue Ash, Ohio.
And today we're going to talk about pain.
And where does it come from? How do you find out where it comes from? What do you do with it when you know? And does it really show up on an MRI scan and an X-ray?
So in my regenerative practice, we do a lot of PRP, which stands for platelet-rich plasma. We do allograft, or what some people call stem cell therapy. And we focus a lot on intra-articular injections, large joint injections such as shoulder or the knee. We treat foot pain, we treat wrist and hand pain. So we do this with PRP, with or without stem cells. And in my practice, that's the extent of the pain the pain spectrum that we treat. Now, Dr. Blatman, I know your practice here, you go far beyond what I do at Regen Medical Centers.
And we do those things also, but we find that so much of this pain, we also treat headaches a different way, and shoulders and necks and arms. But when we see a patient who comes to us with pain, we as the physician are being asked to play CSI to find out what it's coming from. And so we've developed what we call the Blatman method, which is 4 rules for playing CSI to figure out where does my pain come from. Rule number 1, we can't really believe where we think the pain is. The pain in the headache doesn't come from the head. The pain in the arm, left arm, could be a heart attack. How many people do you know with knee pain and they've had that joint replaced and the knee still hurts?
Right.
The pain doesn't come from where we think we feel it. Rule number 2, it's not so important as we were taught what the pain feels like. How many times patients come to you and spend so much time describing it burns, it's numb, it tingles, it aches, it's sharp, it's stabbing, and we have all these descriptive words.
Yeah, all the time.
Isn't it interesting to know none of them matter and they don't make a difference? And the answer to that is twofold. One is the brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, and even sexual arousal comes from the same nervous system. And those terms are not diagnostic. We were taught that burning means something different than aching means something different than sharp. And if you talk to somebody in pain, more often than not, they might feel all those sensations at the same time and not be able to differentiate them. And the way we were taught, if a patient really describes what they really feel, we might think they're not telling the truth or that they're crazy and seeing. So that's rule number 2. So if you can't believe where you think you hurt, you can't believe what you think it feels like, rule 3 is what you can believe. You can totally believe that specifically, millimeter by millimeter through your body, where you're tender, is either where the fascia that holds you together is tied in a knot, or where the fascia weaves to your body and holds you together, and the injury is.
Yeah.
And rule number 4, doing a very meticulous exam like that, the places that are most tender generally generate and are responsible for most of the pain people think they feel. So then our skill set is to be able to feel finer than an MRI and finer than a CT scan. The texture of the body will tell you where the injuries are. And then these regenerative medicine techniques, using platelet-rich plasma, prolotherapy, prolozone therapy, allograft procedures, we can get the body to heal in such amazing ways. We'll talk next time in our visits about, can the body really grow new cartilage? Because regenerating joints is so important. But today, understand that the pain is not what we were taught, and the healing for that pain is something we've never seen before. It's not taking Motrin, it's not taking medicine. Medicines don't fix this.
Sure. Yeah, this is counterintuitive to a lot of people. So pay attention, especially to the first 2. Your pain may not be coming where it's coming from, where your body senses it's coming from.
So just because
you can't interpret that pain.
You have that pain in your back, it may not be coming from your back, even though you have an X-ray that says you have a disc or you have this or that. Those problems are not necessarily the part of your injury.
And without the proper technique, you may not find the source for that pain.
One of the most fascinating studies was 30 years ago, looking at 100 men, 40 years of age, that have never had back pain, never had a back injury, 30% of them had a herniated disc. And 30% of that 30% had 2 or more herniated discs. So just because you have a herniated disc and you've been taught that that's causing your pain, that's not necessarily so.
Yeah, very interesting. So you see that on an imaging report and you immediately assume that's where the pain's coming from.
Because we were taught, if we can show an abnormality on an x-ray or a study close to where your problem is, doesn't matter whether it's a blood test or anything else,
Right.
we can tell you your problem comes from what we see on this chest. Sometimes that's the right answer. Sometimes that requires a leap of faith we have no right to make.
But time to rethink it.
That's right.
Yeah.
And that's our time for today.
Yeah. Dr. David Ellison with Regen Medical Centers, Westchester, Ohio.
Hal Blatman, Blatman Health and Wellness Center in Blue Ash, Ohio. You have a wonderful day.
Thank you. Have a good day.